My name is Dr. Raj Selvarajan, and I'm a specialist general practitioner who performs vasectomy. And my practice is in north side of Brisbane. I do practice in other parts of Queensland performing vasectomy. Today, we are going to talk about why GPs may want to consider adding the vasectomy as a skill to their set of skills. And sometimes to share my journey can help others to relate to and see whether they want to take up this field. I did my general practice training in the UK, and after doing general practice training, I was practicing as a full-time GP, exploring what else I can do. And as many of the things that we do, we need to have training, and an opportunity came up for a vasectomy training in my local area because there was a demand for it. And I think that basically was the day when I thought, okay, I need to go for this training, invest some time and money and effort into it, and see what I can get out of it. And to be honest, I think the vasectomy training in the UK is different to what is happening in Australia. In the UK, you have a structured training program for vasectomy under local anesthesia, and you have to have a trainer who basically supervises you and helps you through the journey. And you have to perform so many vasectomies to get yourself signed off to say that you can perform this procedure, and you get a certificate saying that a specialist skill in local anesthetic vasectomy, and then you can perform vasectomy under contract. However, in Australia, that is not the case. Most of the people who have performed vasectomy have had training elsewhere, possibly in the UK or US, or they worked in the hospital setting, or they worked with somebody who has been colleague, and there's no formal training program for that. So that's important to understand how you can get the training in place. Doing the training is a bit of a challenge anywhere. When you're learning new skill, you're basically new to the field. You need to have an understanding about how the procedure steps are involved, how the procedures perform, what procedure steps are involved, and then trying to do that on a live patient. Having a procedure done under general anesthesia is totally different ball game to having a procedure done under local anesthesia, because the patient is conscious. And doing a procedure like a vasectomy on a conscious patient, and if they can feel discomfort, pain when you're doing the procedure, it's a very kind of a challenge. You have to make sure that the patient is anesthetized comfortably, and if you are not giving the anesthesia in the right place, then the patient is not going to have the pain relief, and they might feel everything what you do. So on the first day of my training, after a few hours of being in the procedure training, I felt as if I was like, I can't do this. It is not possible for me to go for this, because I was losing confidence. I was finding it extremely challenging. And I was like, what have I got myself into? Is this something that I want to do? On the first day I finished the training, I was like, really, I thought this would be easy, but it isn't easy, and I'm not happy about it. I'm not feeling confident about it. And in fact, I told my wife, I said, I don't think this is going to happen. And I have to give credit to her, because she basically said, yeah, you'll be fine. Go for the next day. So there I go for the next time. And I think the next day was 100% better. And sometimes you have some learning happening during the time that you're not actually doing things. It's a subconscious level of learning as well, and that helps you to understand things better. So having an important understanding about the challenge that you might face before going into the training program part of it is important, because then you can feel that, okay, this is normal learning curve. This is normal for me to feel this way. I need to push through this one. I will get there. So motivating and keeping your confidence and things going is important for completing the training process. And I think having all the theoretical information helps beforehand. I wish that I had something like a workshop like what HealthCert does now. At that time, we didn't have any of the things. Yes, you're given a manual to read, and then that's it. Not go through what salient features that you need to focus on. So I think preparation is important before going for training. So once you have the training done, you perform few vasectomies under supervision, and then unsupervised practice as well. And over a period of time, you're still learning. And there are milestones in the vasectomy journey. First 150 is a milestone. I wouldn't take on any complicated cases until I'm feeling fully comfortable. So I will say there are 3 milestones, I would say, if you're looking at a vasectomy journey: 150, 500, 1,000. So For me, it was like first 150, I was not going to operate on anybody who's had any procedures in that area before. So no hernia, no hydrocele, no varicocele, no complicated cases. So I was very selective on whom I was going to do the procedure. Once you get the 150, if you start feeling okay, I can do more, and you take on a little bit of a challenging things. And that's when sometimes things can be really challenging, because you're taken a little bit out of your comfort zone. So the 500 mark comes there. So up to 500, you're still learning, doing things. And after 500, you start to really enjoy doing the procedure. You keep doing it. And I'd stop counting after 1,000, realistically, basically, because you're just basically doing the same procedure on different people. And that's what makes this job very interesting. So you're meeting different people, helping them out, and you're trying to do that job, which in your skill becomes more easier because you're more comfortable, confident, and you're able to do the job. Now and then I still have patients who are very challenging technically, and that's the case. That's the beauty about human nature, and the anatomies are not always the same, and sometimes you can't perform the procedure on some people. We have to accept it. This is how the technique has basically influenced in the last almost 2 decades for me. And I think now I really passionate about what I do. I really enjoy what I do, and I think most of the vasectomists are obviously enjoying what they do as a procedure skill, and because it's very kind of technically rewarding. In terms of once I was doing a lot of this procedure, when I came to Australia and I was looking at the landscape of vasectomy training and things, I really couldn't find anything that was similar to UK. And that made me realize that there is a really gap in the market here. There were only few providers here and there doing the procedures. Some of them are still doing traditional vasectomies rather than non-scalpel technique. And some of them basically covering huge areas where there is only one service there. So there is a clear demand for it. And I was like, okay, how can we basically address it? It would be impossible for me to go everywhere and do perform vasectomies every place. That would be, it's just not logistically possible. And I didn't want to burn out like that. I have basically worked, set up clinics in different parts of the country in the UK before, and I know the challenges. It's not easy to sustain a service by one person, one team going and doing everything in every day, logistics as well as the energy factor. So I was thinking, how can we basically improve the services? How can we improve others to do the services? How can we basically deliver the service more? And one of the things that we know as evidence is, one of the reasons why men don't go for vasectomy is not because they're afraid, not because they don't want to do it, not because they basically think it's a bad idea. The reason why they don't do vasectomy often is because the health professionals are not offering them, and the health professionals are not talking about it. So if we can basically address that part of the stumbling block, we have more patients going for vasectomy and more patients will be having it. So I was keen on, okay, how can we basically encourage others to do it? And that's when I spoke to Health Cert and I communicated with them, and they also were very positive. They basically did their own research, and they also come to the same conclusion. Australia does not have a formal mechanism, and we can basically help set certain things. So the workshop was this way of, okay, it gives you a window of opportunity to see into this field, see whether you want to come into the field. It gives you all the information that you need to have before you want to enter into the field. Because if you had all the information, you'll be more safer doctor. You'll be providing better care. You'll be providing a good care for the patients, which is going to benefit everybody. So the workshop, I think, was purely designed in that point of view, covering all aspects of knowledge that's gained over many years. And there are times where I wish I did known this before. So all of them are basically compiled together. And the workshop has been conducted successfully over the last 7 years. We have had a lot of people go through the workshop and they have benefited from the information. And I'm not sure how many of them decided to do fully vasectomy, but I'm pretty sure that whatever they're doing it with all the information advantage that many of the doctors in my time didn't have. The next part of it is sharing how I do the procedure with other doctors and helping them hands-on as well. That is a learning curve for me. I think, one part of it is doing the procedure, but allowing others to see what you do and allowing others to do what you do is a totally different thing. So it is important for me to basically be selective on whom I train, and because not everybody is going to be in the same level. Those who don't have surgical skills in the past are a little bit harder to train in my experience, and I expect them to have at least some basic skills, and at least one of the test is to, can you do a hand tie of the knot? If you can hand tie the knot, then you have some dexterity, you have some skills that you can deal with in case you need to deal with a blood vessel that is necessary to tie off. So we are very kind of looking for people who can achieve the goal. So there's no point in getting somebody to go through training and find that they're not achieving the end point. And I think that's one of the things that people sometimes, they get a little bit upset that they are not being offered the position. But sometimes we know that this is not right for this time. It may be okay after a period of time, but not this time. So the learning curve, we need to understand, is going to be taking time to get the proficiency of the technique. So we basically take them through not just the consultation, consent, and all the rest of it, but also every step of the procedure: how to give the local anesthesia, how to isolate the vas, how to apply the clamp, how to externalize the vas, how to do the occlusive technique part of it. So it's very important for doctors to understand that there's a lot involved in gaining the skill. Once you are training as well, there will be ups and downs. Some cases you will say, okay, that's not bad. And some days, oh, I can't do it. I don't know why I can't do it. And then we go through what was the problem, why your case was not easy to do, why it was difficult, what could make it better. So we take time to go through every challenge and try to understand and make that person achieve that goal before moving to the next step. So we don't have any kind of set number of cases you have to perform, to basically do a procedure, because nobody stipulates that. I know that, you have to have so many cases, like 40 cases, to do the procedure proficiently. But it's important to understand it is not possible sometimes to just do 40 cases and still be proficient. Sometimes it need more. Whereas if you have done procedures in the past, if you have done vasectomy in the past, then you don't need 40 cases. It's all about how you're comfortable and confident and how competent you can do the job. So I think it's important to take into account the time that is taken for training, the important to understand the steps that is necessary to get that training. And I think we now are in a comfortable position where we know that if we take on a trainee who comes for the hands-on course, we can make sure that that person is comfortable with finishing the training and doing the job comfortably. So I think it's medical legally as well, it's important to make sure that you're confident in doing the procedure. I think it's kind of a rewarding experience when you see trainees calling me and saying, okay, doc, Raj, I've done my first vasectomy today, thank you for helping me, and it was great. I think that's a call that I really appreciate, and I feel happy about that we have got another person who's delivering a service in their locality. There is a lot of demand for this procedure. It just is like hidden demand sometimes. I go back to the conversation about the typical market, and most of the times people think the typical market is 30 to 50-year-old men who want to have the procedure. But what I would say is 30 to 50-year-old women on long-term alternative contraception are all in the market as well. So I think once you have the procedure service available for patients in your area, patients will find you. I think, and word of mouth is important means of getting more patients who are going to use the service as well. I'm quite happy that, we are delivering a service to the patient, but that's also helping doctors to do the same in their locality. And I hope that you would enjoy doing the procedure, getting information about the vasectomy course, as well as if you're seriously thinking about having hands-on, then you need to be prepared to invest your time and energy into getting the skill, because it does take that time. Thank you.